Hello, I'm Dr. James Bogash, publisher of Modern Health Myths. And today the article I'm going to talk about really hits close to home. As a chiropractor, I see patients with back pain on a regular basis. And more often than not, I am talking to people off the ledge from things that they've been told they have on an MRI, or their doctor or their surgeon or somebody told them not to move, to be careful. Um, they For some reason, we seem to think that we need to scare the heck out of patients, that if they go out and they move, they're going to break and things are going to get worse. That is almost never the case, with maybe a very few exceptions. But you are far more likely to do damage by not moving than you are to do more damage from moving around when something hurts. Having been in the martial arts for a long time, I know that the times I've been injured, I don't let that slow me down. I let pain be my guide. So one of the reasons why I haven't, in going on 30 years now, haven't even taken so much as an ibuprofen or Tylenol. I need that pain to let me know what I should and should not be doing. So in particular, this study looked at people who had back pain, and it was in almost 1,000 patients in one particular study, and they asked them at 2 points in time, so basically the entry point and then another point in time, if they had back pain. And the biggest factors about in regards to whether or not somebody was going to have back pain later had to do with psychological factors, catastrophizing. I can never say that word. I can barely spell it. But basically being worried that this is something major and a big deal created more problems than it solved, and led to people having more problems or a longer duration of problems, which is ironic. So the one thing that leads you to have more problems down the line is being worried about having more problems down the line. Fear of movement, um, that's a technique or a term called uh, movement anxiety. I'm blanking on the term right now, but fear avoidance behavior. So being afraid to do things because you're afraid it's going to hurt you. With chronic pain, that is one of the worst attitudes that you can have. As a chiropractor, when a new patient comes in, one of my jobs is to reassure them that everything's going to be okay. And almost always, the couch potatoes are harder to fix than are the athletes, because when we move, we respond better to anything that's done to us. So as always, I will post a link to the study in the comments section, and feel free to like this video, share it with somebody you think really needs to hear this message, and subscribe to the channel.